I'm Dr. Aliaksandr Ramaniuk, and I'm a pulmonary critical care physician here at Summa Health. I'm here to talk to you today about pulmonary function tests, also known as PFTs. As we age, our lung function may worsen. Some factors like smoking, infections, environmental or work exposures, and lung and chest diseases can make our lung function deteriorate faster than usual. This is why it's important for you to regularly check your lung health as you get older. To evaluate your lungs, we often need to see what the lungs look like on a CT scan, and we also need to know how your lungs are working, and we evaluate that through PFTs, or pulmonary function tests. Here at Summa Health, we have several different PFTs to measure your unique and specific lung function. These tests include spirometry, a breathing maneuver that measures the amount of air you can inhale, the amount of air you can exhale, and how quickly you can do that. Spirometry may be able to be performed before or after a bronchodilator medicine. Lung volume testing is another test, and it can measure your lung volume and the capacity by several different methods that include breathing in oxygen for several minutes on a special machine. Another test we can use is a diffusion capacity, or known as DLCO, a breathing maneuver that requires a brief breath hold to assess how well your lungs allow oxygen to pass in and out of your lungs. A broncho challenge test, typically used to diagnose asthma, but find out how reactive or responsive your lungs are after inhaling either an aerosolized chemical, cold air, or performing an exercise to see if it induces asthma symptoms in a controlled environment. And finally, exhaled nitric oxide level, or FeNO testing. This test can help diagnose and further manage asthma. It measures the amount of nitric oxide you exhale out of your lungs. The exhaled nitric oxide test is different from most PFTs, is that you need to blow slowly and steadily, not hard and fast, to get an accurate measurement. We use PFTs to identify why somebody is short of breath, why they're coughing, wheezing, or just not able to do the things they used to be able to do. PFTs help us identify many different diseases, including asthma, COPD, lung scarring, pulmonary hypertension, heart issues, vocal cord or throat issues, and other airway and lung problems. We can see how mild or severe the disease is, and we can monitor function over months and years to check what therapies are working or how fast the lungs are changing. It is also important to check your lungs before surgeries and procedures. If you've been prescribed pulmonary function tests, or PFTs, here's what you may need to know. PFTs are completely painless and quick tests that can be done at your doctor's office or in the clinic. Your respiratory therapist and your doctor will help explain and guide you through every step of the test. Before your PFTs, you may be asked not to use certain inhalers or medications. If you smoke, do not smoke for at least 6 hours before the test. Try to avoid eating a large meal. Wear loose, comfortable clothing that won't interfere with your ability to take a deep breath. You should let your doctor know if you have a recent heart or lung problem. Let your doctor know if you have dentures, have changes in your health, new symptoms, or infections just before starting the test. At your appointment, you'll be asked to sit down comfortably with your feet planted flat on the floor. You'll raise your head and your chin so you can breathe comfortably and easily. A clip will be placed on your nose, and you will breathe through a special mouthpiece. A respiratory therapist will instruct you to take normal breath first, and then the biggest breath you possibly can. Then you'll blow out the air as fast as possible and keep blowing until your lungs feel completely empty for up to 6 seconds. Then the technician will tell you to breathe normally. It is important for you to give the maximal effort you can during the test. The test is usually repeated 3 times to ensure accuracy. You may be asked to take an inhaled medication to open your lungs after the initial round of testing. The test will then be repeated to see how your lungs respond to this medication. In rare cases, breathing fast and hard for the test can make you feel tired, dizzy, lightheaded. It can make you cough or have chest tightness or pain. You should let your technician know if you have any discomfort. If you have concerns about your lung health, ask your doctor about pulmonary function testing. Pulmonary function tests are a quick and easy way for your doctor to understand your individual lung health. Our pulmonary team at Summa Health is here for you to answer any questions and to guide you through every step. We're dedicated to keep your lungs healthy and helping you breathe better. For more information, call 330-319-9700 or visit us at summahealth.org/lung.